Arizona's Mayo Clinic is getting ready to graduate a new batch of doctors this spring. Mayo hopes that these new graduates will help break down barriers and health disparities that have prevented some patients from getting proper care. Joining us now is Dr. Jewel Kling, Dean of Mayo Clinic Alex School of Medicine. Good to have you here. Welcome to Arizona Horizon.
Thank you so much for having me.
You bet. All right. This new group of doctors, they're ready to go, but there seems to be a specific focus for lots of them. Talk to us about that.
Yeah, fantastic. And I'm so grateful that you're having us immediately following our match day, where we have such great results of our students matching into really competitive specialties, including many here in Arizona. But many of our students recognize that there's health inequities that need to be addressed. And so they are targeting their future careers to look at ways to address those needs and better serve the needs of our patients and our community, both here in Arizona and beyond.
What are the inequities and where are those communities?
Yeah, so there's so many different inequities, but we see this based on diversity. So different groups of people have access to care differently, and it may be based on race, ethnicity, their language, access to care, things like homelessness and other things that impact folks. Our students are really passionate about finding ways to overcome those barriers and meet those patients where they're needed.
As far as the patients themselves and as far as the doctors focusing on, were these doctors that specifically went to Mayo to do something like this, or were these people in the program and said, hey, wait a minute, there's a need, I need to fix it?
That's such a fantastic question. And it's really a mix of both. Many of our students come to us already doing a lot of this work. Some of them even from local schools like Arizona State University, who are dedicated to meeting the needs of things like the refugee population. But some may have experiences during medical school. For example, working at a clinic that serves people impacted by homelessness or folks that don't have health insurance, and then get motivated to take their career and serve that population in the future.
And the impact on the physician shortage issue, we've talked about that on this program as well.
Yeah.
First of all, how much of an issue is that, and how does that, what you're doing right now at the school, how does this address that problem?
Yeah, the physician shortage, especially in certain areas like primary care, is significant. In fact, we saw those numbers in the last couple of years here in Arizona, and that's why a lot of the schools are expanding to make sure that we're training more future physicians. I think what our students are dedicated to doing is going to address that. In fact, in our recent match, we had 28 students that matched to primary care specialties, 28 out of 102 students. So that's a significant percentage. A good percentage of our students also matched locally here in Arizona. So I'm so grateful. Those are the doctors that are going to take care of you and me, Ted, in our future, to help address those shortages in physicians here we see in Arizona.
And again, this emphasis by graduates on serving places that have not had the same kind of service in the past, is this something new?
I think we're seeing it more, but maybe people are feeling empowered. A lot of them based on their personal experiences. We have students that are Spanish speaking that want to serve that community, folks that have experienced things like homelessness, or perhaps vets that want to serve that population, that then feel compelled to come to medical school and really go on that journey to be able to serve that population.
And with this graduating class, those in the pipeline, are they seeing something like this and they're saying that's something I want to be involved in?
Yeah, I think that definitely has a trickle-down effect, which is fantastic. For those of us like myself from Arizona that see there's so much need and so much that needs to be done, we're so grateful that these students are excited to step up to that task.
And this is all very positive, but I have to bring up something that the state legislature and on Capitol Hill and Congress, there seems to be a blowback on DEI in general, DEI at universities and medical schools in particular. How is Mayo handling that, especially with this kind of an emphasis? Does that concern you?
Well, the beautiful thing we have at Mayo is our value system that really sets us apart. The needs of our patient come first. And so we will continue to prioritize that, both in our clinical practice, but also in our education at the Mayo Clinic Alex School of Medicine. And one way that we see to really develop a workforce that can help address health inequities, especially serving a growing diverse population here in Arizona and beyond, is to diversify our workforce. So we'll continue to do just that.
And I would imagine showing where some of these graduates go, who they serve, how they serve, and the results would play a factor, I would think, into the debate, but you tell me.
Yeah, absolutely. I think the ramifications, when people know it's them, it's their family members, it's their community that are positively being impacted by this work, I think they'll get behind it and recognize the need.
All right, very good. Dr. Jill Kling, again, Dean, Alex School of Medicine in the Arizona camp. You guys have so many titles and so many places and so much going on. It's, yes?
Well, I was going to say we're a national med school, so we're not just in Arizona, we're in Rochester and we're in Florida. So we have deans on all of our campuses, making it more complicated for our introductions.
Yeah, there you go. But it's good to have you here. And
Thank you
thanks
so
for the
much.
information. We appreciate it.
Yeah, thank you.